Hello, I'm Pauline from Pendulum Massage of London, and today I am giving a presentation on the role of massage and self-care for those living with cancer. I put together this presentation for an event that was held on February the 4th of 2025. The event was to commemorate World Cancer Day, and it was organised by Lynette Denton, who runs a charity called SEOLCEG. It's a palliative care charity. It's based in the UK. However, they raise funds for palliative care and education for health professionals in Guyana, South America, and in the Caribbean. So, World Cancer Day was put together at the World Cancer Summit Against Cancer for the New Millennium, which was held in Paris. And they put together a charter that looked into the promotion and research, prevention of cancer, and improved patient services. And what they suggested was that it should be recognised by UNESCO, which it now is, and it's a yearly event in order to continue that service to mankind. So, okay, I'm going to start this presentation with an introduction which will look into these three areas: the definition of cancer, the importance of holistic care in cancer care, and the emotional, physical, and spiritual challenges faced by patients. So, to begin with, cancer can occur in any part of the body, and cancer is defined as damaged or rogue cells that grow out of control within the body. Cancers are often identified by the part of body that they are within. So, for example, carcinomas exist in epithelial or skin cells, body cavities, and the organs, while sarcomas, more self-contained, are often in bone and soft tissue. If these cells don't spread, they're called benign, and benign cancer is considered less harmful simply because cells do not grow in different parts of the body and they don't metastasize. Myelomas are plasma cells where antibodies are normally manufactured. And leukemias are blood cells, and blood cells originate in the bone marrow. Lymphomas are in the immune system, and for example, the lymph nodes, for example, in the tonsils or in the armpits, the spleen, stomach, and the testicles. And finally, mixed types derived from multiple cells and tissue types. The majority of cancers, some 90 to 95%, are due to genetic mutations from environmental and lifestyle factors. So what this means is that cancers can be affected by how you live and how you work and where you live and where you work. So bearing that in mind, it's important to understand that our lifestyle choices and our lifestyle conditions, sometimes where we don't have a choice over them, can actually affect our likelihood of getting cancer or not. My personal connection to cancer is that I actually had this lump here, which I named Elfrida. Luckily, Elfrida was a sarcoma. She grew in my abdominal muscle and into the epithelial tissue of my abdomen, and she was removed a long time ago, I'm grateful to say. With regard to cancer, the National Health Service and many organisations now use this biopsychosocial model of care in order to show what they consider tip-top in helping sufferers of cancer recover and get the best treatment possible. So when you go into a hospital, the biological is the key thing that's taken care of. So your physical health is paramount. Your symptom management is dealt with, and your medication and treatment are all managed in such a way to prolong your life and give you the best biological support, best biological edge you can get for recovery. In the old days, this was purely it. Nothing else was added. And in fact, where possible, visitors were allowed at specific times, friendships were allowed at only specific times, networks weren't really looked into, and community links weren't considered. And in some ways, when you're ill with a condition like cancer, you need all the support you can get. So, bearing that in mind, why not have community links included? Why not look into health inequalities? Why not inviting parents, family, and friends at any time that they want to visit? This would be the gold standard. Now, the things that the medical and the social generally don't touch upon as much as the psychological. So, what are your health beliefs? In the old days, when you said you had cancer, people say, they're a goner, that's it, nothing can be done. Now, people believe differently. They believe that they can get care and attention. They believe that cancer is curable. A life narrative. Well, the psychological is a lot of people believe their life is a set path and that fate has judged them so. This is not necessarily the case, and some people believe that their life narrative can be altered, can be changed, is not fixed. And the modern view is that your biological and your social and your psychological life narrative can be changed. From sickness, you can go to wellness, and we can create that narrative within our well-being. Self-efficacy, the ability to understand what's going on and how you can affect it and how you can change the narrative of your life, yourself, and finding your emotional health, being able to manage your emotions perhaps, or even influence how you feel about certain things in your life. These are incredibly important, and having a peer support network to help you address these issues is considered a holistic approach, a biopsychosocial model of care. Dr. Arlene Geronimus wrote a book 2 years ago called The Weathering Hypothesis, The Extraordinary Stress of Ordinary Life in an Unjust Society. This book raises the idea that chronic aging occurs through stress in life. And stress in life and chronic aging means that poorer people, people who are dispossessed, die earlier. And it's quite a distressing one, actually. Weathering is actually the result of chronic exposure to social and economic disadvantage. Weathering can include racism, microaggressions, and political marginalization. So let's see the wraparound holistic model of the biopsychosocial model of care. In the old days, you'd go into hospital, and often the medical side of things was the key focus. The key focus is that you'd go in, have surgery, and get either radio or chemotherapy, and you would have a brief discussion with a consultant, and bang on, they'd get on with the treatment plan, your symptoms would be managed, you would get your medication, you'd get your treatment, you'd be out. For some, this would be an alienating experience, with the only plus side being that the cancer would be treated and gone. Of course, the medical has to come first and foremost, but hand in hand with that, the healing journey takes on loads of different aspects that can actually make the experience of getting better easier. So having a social support is incredibly important. Nowadays, in the NHS, you often ask, who's going to be your caregiver at home? How will you be able to support yourself whilst you're getting the medical attention that you require? Do you have a network or a spiritual group that you can go to? Is there a church or a mosque or a temple that you can draw support from? Allied to this is the emotional side, the psychological side. And you need psychological support during your time of healing. Will you be able to manage mentally with how things are going on? Can you advocate for yourself Can you tell people what it is that you are better or worse for? All of these factors work together in the biopsychosocial model. You are seen as a whole and without that sense of wholeness, your journey won't be the same as any other person. Oncology massage is the complementary therapy that I use for this particular journey to help people alleviate their symptoms. It's important that oncology massage addresses the whole person. So, say for example, you suffer from nausea and vomiting because of your treatment, because of your care program. Having a massage, once you're over the major forms of discomfort from chemotherapy, for example, your nausea can be lessened because you're having a more calmed treatment, you're having a calming oncology massage. Your perception of pain will be reduced as well, simply because when fascia is tight, when breathing is faster, it's difficult for the muscles to calm and relax. But with a massage, this can happen, and then when you have these symptoms, they are less apparent, less painful. Quality of sleep is improved during the course of massages. And sleep is incredibly important. And the key thing is that during the sleep cycle, there's so much the body is doing. But the key thing that the body is doing is repairing damaged cells. And cancer treatment, unfortunately, there's a sense that there is destruction, but it's destruction of things that are not required in the body, for example, the cancer cells. So if you're having chemo or radiotherapy, these are targeting damaged cells. The important thing is that during sleep cycles, where you've had a massage, you're more relaxed and you have a full sleep cycle, less stress, more relaxation, the body is able to repair better. Included in that, fatigue from illness is also worked upon. So deep rest is encouraged. So fatigue, body is refreshed at a greater and faster rate. These benefits can make a difficult situation much easier to deal with, and it's important that having a biopsychosocial managed care plan can help you to get over the physical, the emotional effects of cancer treatment. So, lifestyle and wellness tips. Obviously, it's important to have a really varied and balanced diet to support recovery. And it may well be that you would need support in order to get that. For example, if you're not well enough to go to the market, go to the supermarket to buy foods, you may need to rely on outside parties to assist you there. But where possible, it's really important to get those colourful vegetables and fruits into the diet. It's important to get good nutritious food with your proteins and your carbs, vitamins and minerals and fats and healthy fats in the diet. Opportunity for movement is also incredibly important, whether it's gardening, walking, and moving about, whether it's dance or chair-seated exercise or going to the gym or swimming, whatever it is, getting that sense of replenishment and energy and mobility in the body is key to wellness and getting better. And also, if you're using up the energy, sleep will be better again, requiring your body to repair and rest and revive for the following day. Things related to mental health may include mindfulness. Some people use prayer and spiritual practices to get them through, and also group support and counselling can be incredible helps. The personal approach to combating weathering is very much like the self-care model in the previous page, lifestyle and wellness tips. Combating weathering on a personal level requires a few things for sure. The first thing is restorative self-care. Now, this could be deep breath work, or mindfulness. And in this respect, we can think of it from a community point of view as well. When a collective rests together, it's a day of rest, and most belief systems have that within them, built in. Breath work can be found in prayer, in repetitions, in recitations. All of those things have breath work, and breath work can help to reduce cortisol levels and reduce the levels of adrenaline in the body, which in themselves are stress related hormones. When working mindfully is just noticing things. When you notice things and don't comment on it, you just notice the beauty and the differences in things. This is mindfulness, paying attention, not being on autopilot. All of these combat physiological effects of chronic stress. Physical activity and movement. Now, it's commonly said, well, if you want physical activity, you have to pay for it, but not necessarily. We're talking about exercise, dance, gardening, walking. All of these simple, low impact activities can create a sense of strength training and reduce stress related damage, because they help to deal with feelings of adrenaline and cortisol, stress related feelings in our bodies. Physical activity and movement. Well, it doesn't have to cost a penny to combat weathering. Dancing, gardening, simple stretches, and picking up heavy things and letting them go. These are all forms of strength training which can buffer the effect of stress-related damage. Nutritious diet. Eating foods that are rich in nutrients, that are colourful, vegetables and fruits, that are whole foods, that are healthy fats found in nuts and seeds and fruits and vegetables. These all combat cellular damage in the body and provide us with the antioxidants we require to repair all those free radical damaged cells in our body. Sleep hygiene. Avoiding screen time. Trying to stay from the phones, the smartphones and the TVs within the last hour or so before bed is incredibly important, because good sleep you start planning good sleep an hour or so before you actually go to sleep. Getting good sleep allows for cellular repair, it allows for good brain health, and it allows for stress recovery. And finally, community building and cultural healing, using ancestral practices and community practices in order to build our spirituality, and also cultural traditions which foster resilience are incredibly important. So church, mosque and temple, community group, humanist group, belief system group, political ally groups, all of these things are incredibly important to help us combat weathering. In conclusion, I hope you found this talk of interest. Seek out what you need in order to heal. Seek out what you need that does not aggravate you. Make sure you have that community around you, and if you don't have it now, seek it out. They are there and they are ready to welcome you, because nobody should be suffering on their own in the fight against cancer. You are more than just a person that needs to get cut open and healed. You are an individual who has a cancer journey that you can go through with good company, with people who understand you, with an understanding of who you are and your background. Okay, I'm going to sign off there. There will be some show notes. And here are some of my contact deets as well. So if you found this of interest, do reach out to me, tell me what you think. If you would like further information about what I do, my website link is there, and I wish you all of the best and all of the flowers.